Hey there, welcome to my podcast, where I talk about oral health in ways that are real, relatable, and easy to understand. I am Rakshana, a final year dental student, and today we're going to talk about something serious, something that does not always get the attention it deserves. That is oral cancer. When we think of cancer, our mind often goes to the lungs, the breast, or even the colon. But did you know that oral cancer, that is cancer of the mouth, affects thousands of people each year and it's often diagnosed too late? So today, we're going to break it down. What is oral cancer? What causes it? And what should you look out for? And most importantly, how can you prevent it? So, what is oral cancer? Oral cancer refers to cancer that occurs in any part of the mouth, including the lips, tongue, gums, inner cheeks, the roof or the floor of the mouth, and even the throat, what doctors usually call the oropharynx. Like all cancers, it involves the uncontrolled growth of cells that can invade nearby tissues and spread to other parts of the body if it is left untreated. Now, who are these people at risk? Here are some major risk factors. One is tobacco usage. So, smoking, chewing tobacco, or gutka dramatically increases your risk. Second, alcohol, especially when it is combined with tobacco. Third, human papilloma virus infection, which is particularly the human papilloma virus 16. Fourth, poor oral hygiene or chronic irritation like sharp teeth or ill-fitting dentures. Fifth, sun exposure, which can affect the lips. Sixth, family history and age. Most cases occur in people over 40. But here's the important part. Oral cancer can affect anyone, even those without the traditional risk factors. So let's take a look at some of the signs and symptoms that you can notice. So what should you be looking out for? So if you notice anything of the following lasting more than 2 weeks, get it checked immediately. First, a sore or an ulcer in the mouth that doesn't heal. Second, a lump or thickening in the cheek or tongue. Third, red or white patches in the mouth. Fourth, difficulty in chewing, swallowing, or even speaking. Fifth, numbness in part of the mouth. Sixth, a persistent sore throat or feeling that something's stuck. Seventh, unexplained bleeding in the mouth. And eighth, yes, even a change in voice. Now listen, these signs don't always mean cancer, but early detection obviously is going to save lives. So the earlier it's caught, the easier it is to treat and the better the outcome. Now let's talk about how it can be diagnosed and how it can be treated. Now, oral cancer is usually diagnosed through a clinical examination followed by biopsy if anything suspicious is found. Here, dentists play a very crucial role. They're trained to spot early warning signs during routine checkups. So, treatment can include surgery, radiation therapy, chemotherapy, or a combination, depending on how advanced the cancer is. Now, prevention. So the prevention, that power is in your hands. The best part, oral cancer is one of the most preventable cancers. And here's how. First things first, quit tobacco in all forms. That is, today is the best day to start. Second, limit alcohol. Third, practice safe oral habits, including safe sex to reduce HPV risk. Fourth, eat a healthy diet with plenty of fruits and veggies. Fifth, visit your dentist regularly. Even if you have no teeth, an oral cancer screening can still be done. Sixth, protect your lips from the sun with SPF lip balm. So finally, one more thing. Don't ignore unusual signs in your mouth. Trust your instincts. If something feels off, get it checked immediately. Oral cancer is serious, but awareness is powerful. The more we talk about it, the more lives we can save through early action. That's it for today's podcast. If you found this useful, please share it with your friends and family, especially those who use tobacco or may be at risk. A simple conversation could actually be life-saving. Until next time, I am Rakshana, reminding you to take care of your smile because it's more than just teeth. It's your health, your life.